welcome to one other edition of the exciting Digital Dialogues podcast series that Cigniti brings in. And today, I'm really thrilled to be discussing this topic at length, which is something that I believe in the modern day context of enterprises getting swept away by this realm of Gen AI, particularly in the context of a compliance-driven business environments in healthcare industry. This is something that we are putting together with two of the finest industry leaders that I am glad to be hosting. This is Sairam Vedam, the Global Chief Marketing Officer at Cigniti, your host for today's Digital Dialogue podcast series. And what we're going to discuss today is it's about Gen AI in healthcare, harnessing its potential in innovation and personalized care. Well, for this audience, I'm not going to re-drum what is Gen AI and where is Gen AI helping us and heading. But what we're going to dive deep is into the realm of what's actually impactful, use cases that we are seeing in the world of healthcare, and how, the innovation in an AI-led world, particularly when we have large language models, we have custom language models, and we have variety of data sets to back. How can potential in innovation and personalized care can become a reality? To speak about that, I welcome Ajay and Ram. And I'm also taking this little opportunity to be delightfully introducing both Ajay and Ram, who've done some tremendous work, both with 2.5 decades of experience each in the industry. To start with, Ajay, with over 25 years of experience, have worked in various areas of AI, ML enterprise architecture, and emerging technologies cross-domain. And particularly, he brings a wealth of knowledge and a passion for innovation. But what truly sets apart Ajay is his unique ability to act as a bridge between business and technology leadership. And in his previous roles at a Fortune top 10 healthcare company, Ajay played a key role in driving digital innovation throughout the entire organization. His passion for innovation is further evidenced by his recent US patent for remote patient assistance. And I'm sure this is going to be a thoroughly insightful journey for all of us to listen to what Ajay has to talk about, particularly in this exciting topic. Ajay, welcome to the show.
Thank you. I'm
Thanks,
happy to be
Ajay.
here.
Excellent. And Ajay is joining us from the US today. Along with Ajay, I have Ram. Ram is joining us from the Cigniti side, and today is based out of the Hyderabad office. He's the Global Senior Vice President at Cigniti, a senior technology leader specializing across multiple facets of enterprise digital transformation, transcending AI and ML, generative AI, of course, enterprise architecture, blockchain, and more. I have had numerous conversations, coffee conversations. I've traveled with Ram, and I must say that the pragmatism with which he sort of unravels the tech puzzle is something that will be very useful for the audience. He's an industry thought leader with patent pending work that he has done across domains and a wealth of experiences in transforming global enterprises' digital initiatives, providing superior digital experiences. Ram, thanks for being today.
Thank you, Zai. Happy to be here.
Lovely. So, we'll possibly have this more conversational. I'll pop up some of the questions, rather perspectives that we would want to hear from both of you. Feel free to interrupt in case. So we'll start with Ajay. So Ajay, good morning to you. As we all know, Gen AI promises to reshape the healthcare delivery and empowering healthcare organizations in delivering better patient experiences like never before. With your deep understanding of the industry, how do you envision this technology transforming personalized patient care? Could you share some insights on what you've been working on and where do you see this heading?
Okay, so I'm going to start off by saying three important things where Gen AI is going to play a role in the healthcare world.
Mm-hmm.
First is providing data-driven insights. Second, with virtual health companions, chatbots, virtual assistants that you see. And then hyper-personalized treatment. So these are the three aspects I'm going to highlight. I'm going to share a few stories, and I'm going to elaborate what these three mean and how can generative AI as a technology benefit healthcare in general, right? So imagine a world where your physician, your provider is like a care collaborator. He's not the caregiver, but a care collaborator. humanly, it is not possible to sift through minds and minds of data, medical research that is there, research data that's available in the public domain, as well as EHRs and EMRs of patient records, decipher all that content, summarize, identify patterns, identify symptoms, and offer personalized care to any individual. It is not humanly possible. How can a physician or provider, no matter how qualified he or she may be, identify patterns from minds and minds of data, right? So that's where I see generative AI empowering the provider, the patients to make it more personalized when it comes to healthcare delivery, right? So I'll elaborate with a couple of stories, real life personal stories. I have a family member who a few years ago had a few symptoms, but because of ignorance and carelessness, didn't happen to talk to her primary care physician or the provider. And later on, 3 or 4 months later, she ended up being in an emergency situation where she had to be taken to a hospital, diagnosed with multiple different sessions with the provider, doctor, and then after that, she was diagnosed with a condition that is very remote and very unique to women that come from South Asian origin. But in order for her to learn that she was having that kind of a problem, it took approximately 1 month to 2 months, and even the physician provider was himself or herself not sure about the problem. So imagine if generative AI was at that time prevalent and known, she would have automatically through her symptoms would have been able to identify what it is, provide information, insights to the provider. The provider himself or herself would have reviewed the content, identified that pattern symptom with patients or women of South Asian origin, and it would have been so easy for diagnosis and treatment. But instead, she had to go through multiple different doctor visits. She had to go through a lot of different treatments, therapies, and even now she goes through infusion. That's one use case. And there is another use case when another family friend of mine had to go through an open heart surgery. And in order for the doctor had already identified that that's the situation, and we have to do a surgery, and that was during the COVID times. And in order for us to get that done, it had to be scheduled. All the family members had to go research. Okay, which doctor is the best one in the business? Which hospital offers the best service possible? What are some of the things we have to be careful about? How exactly is that procedure done? And what do we need to be cognizant about? And in order for us to do that, we had to go through several different videos, read through all the different credentials that the doctor has, compare one versus the other, compare all the different hospitals, costs, and all that. And at the end, everything went well. The surgery was good. Everything went well. But why should human beings be researching on all this content time in and time again, right? Why not let somebody like generative AI mine through all the different data that is publicly available and give you recommendations? These are the three or four best hospitals, and these are the 3-4 best healthcare providers who can do the job for you, right? So these are the certain areas where I see generative AI playing a significant role. Basically, we don't see generative AI replacing healthcare providers. Rather, it will empower them with insights from data that is publicly available, data that is specific to the patient with their healthcare records and medical records, and provide very specific, personalized treatment, therapy, and diagnosis. Because every human being is uniquely built, be it their genetic makeup or their life history or activity history. Every individual is different. You cannot have one size fits all treatment like we do for machines. Human beings are not machines after all, right? So therefore, I'm a firm believer. The generative AI is not just a technology. It's here to empower people, providers, and it's going to improve healthcare for future.
Sure. A great set of insights and very relevant examples. I would resonate to what you actually said towards the end, where Gen AI could be used to mine and provide filtered responses so that it might have been much more relevant and saves a lot of time. So that's a great opener, I would say. Let me jump back to Ram now. Ram, I know Cigniti has been at the forefront of providing cutting edge digital engineering solutions and digital assurance services to multiple Fortune 500 companies. Where do you see these companies in their implementation journeys of Gen AI? Because you are at the forefront of doing these conversations, architecting these solutions, and solving customer problems, right? And why do you think each company's journey is different?
Right, Sai. So the lot of the companies that are taking up generative AI now, they are still in a very nascent stage, probably because of a lot of hype associated, and people are still trying to make sense of what actually matters to them, rather than it's they want to ensure that it doesn't end up in a situation of a hammer trying to find a nail. So in that sense, a lot of organizations, from what we are seeing, are experimenting at the minute with Gen AI. They are in very exploratory stages. They're looking at identifying some of the things that Ajay mentioned, resonate very well with some of the work that we are doing, especially in terms of summarization models, and pattern detection and things like that. So a lot of groundwork is being done in the machine learning and the AI space in preparation for the Gen AI implementation, is where a lot of customers are. Now, even that is like you rightly said, each company is different. Then there are some companies who are already implementing generative AI based, especially on the chat and the support side of things.
Right.
They are already live, productionized it. They are optimizing it. Some of our customers that we are working with. Whereas some of them are doing it on a piecemeal basis. They are looking at improving the reporting structure. For example, just the business dashboards are being converted into generated text, for example. So the reason why that might be the case, Sai, in my experience, is that it boils down to the maturity that companies have around data. What data they have, the governances they have around the data, the engineering that they have got around the data. If that is fairly mature, then companies are able to adopt to generative AI that much faster. Whereas in companies where we are seeing that the maturity at a data level is still kind of weak, we are seeing them take their time. Now, this approach is a double-edged sword, because those companies who are trying to get the data in order first are probably going to miss the bus when it comes to jumping onto the Gen AI bandwagon. So it's a tricky decision that a lot of companies are pondering at the minute, and that is the reason why we are seeing a lot of POCs. Like one such example is some of the work that we are doing as a company has come back to us and said, look, I know I don't have a governance structure. I don't know what all data I have. I don't even know what data I have. Can I start using generative AI? And that was a classic case of a summarization model to be built to kind of blindly leverage these vast volumes of data that they have from multiple situations, multiple systems, and try and synthesize that into actionable intelligence that the business can take decisions on. So we have started doing such work. So the long story short is, like, those companies who have got who are mature at how they are handling data, they are well and truly on the journey to Gen AI. Those companies who are yet to reach that level of maturity in data, we are seeing them exploring, more exploratory. And finally, this third set of companies which know that they don't have the governance around data, but they still want to go in for that pie in the sky type of approach to see if it proactively solves a problem. So that's roughly map that we are seeing.
Understood. Quite relevant, I think. As you said, each journey is different and each needs are different, but for sure, the fact that generative AI is at the center of a global business dialogue, that seems to be a constancy. Let me get back to Ajay. Ajay, we are absolutely thrilled to understand that you actually have a patent for a system for real-time analysis of remote health data aggregated with vital signs in terms of providing remote assistance. So considering the impact and the power of Gen AI, do you envision ways to leverage this technology to further personalize, optimize remote patient assistance even further? And where do you see the world of remote patient assistance shaping up?
Mhm. Okay, so regarding the patent that was granted to me in December, it was about an application very specific to a department line of business where people have more than one chronic condition. They go through dialysis at home, or it's some kind of infusion or some therapy or treatment at home. And majority of them are living their life in solitude or isolation. Senior citizen with more than one condition, they have to themselves do the treatment. There is no one around. So in order to help ease out the mindset at that point, to ease out the stress level that the patients have to go through, the patent was about introducing IoT sensors and actuators and devices and remotely capturing all that sensor data and then offering advice from elsewhere, not being in that same physical setting. I do see generative AI enhancing that even further because, like I said, there is ample amount of data already available. EHRs, EMRs, medical research papers that are publicly available. Now we have data from the IoT sensors and devices and actuators, from activity trackers, from life history monitors, from your weighing machines, from all kinds of gadgets that people use to keep track of their personal health. Right, but it is humanly not possible to decipher all that data, make sense of all that data, identify patterns, symptoms, tendencies, accurately predict. It's not humanly possible. So that's where I see generative AI playing a significant role. It can not only decipher that data, identify different patterns and symptoms, be predictive and proactive rather than being reactive. Empower the providers with physicians with more insights and make the information very hyper personalized. So that I do see generative AI enhancing that application even further, not only by providing data-driven insights, but also offering companionship in terms of chatbots. And like Ram said, rightly so, majority of 2023 people were doing pilots, exploring, researching. But I do foresee that in 2024 there'll be lots of applications that will be deployed in production because this is here when we have to implement leverage and benefit in healthcare. Obviously, there are all those different kinds of concerns around bias. Bias can be introduced anywhere. For that matter, human beings are also biased, right? When you develop these large language models and use the data for training, obviously there are possibilities of bias in the data, bias in the algorithm design, bias in human interpretation. After the large language model gives you a response, you have human beings that have to decipher and offer the final output. There can be bias anywhere in this step. But instead of shying away from the technology, we have to have guidelines, guardrails, and frameworks in place to eliminate bias, be it by diversifying the data set or debiasing algorithms or using adversarial training. There are multiple ways how we can make it more transparent and eliminate all these concerns around ethics and bias. And like you rightly said, I am forcing this generative AI to revolutionize healthcare. I do believe that leaders who adopt and strategize and have a game plan will succeed and be able to shape the healthcare for future. And people who don't, and the leaders who don't, they're going to fall behind.
Yeah, so I think you are absolutely right. There are many data insights that we keep reading about where this world is heading more as we move forward. While that said, Ram, so based on your insights in the industry, let us know some common strategies or approaches you would recommend to global enterprises in adopting Gen AI, and before embarking on this journey at scale, right? As we know, there are still enterprises who have apprehension. Some want to do pilot, some are in the mid journeys, and probably a few are ready to go live and go at scale. So, what are some of those pitfalls and common strategies that you would recommend based on your experiences? The pitfalls to avoid, of course.
Right. Now, I think you kind of had half the answer in the question side, which is like the strategy piece, right? So you got to, as an organization, have that strategy in place. Now, what would Gen AI mean to an organization is best defined by the organization at the beginning of this whole process. So what we are seeing more and more is that companies are actually placing emphasis, just like you would have hardly heard anybody talk about data strategy a few years back. And before that, enterprise architecture as a concept existed in very, very limited number of organizations. But so if you go back like 15, 20 years, people would just kind of not think about those things as guardrails or as principles of building these things out. So what has happened is, when the whole enterprise architecture as a kind of a practice area started happening, companies have started making conscious decisions about what they're going to implement, how they're going to use it, and things like that. Then kind of fast forward 10 more years, and you've seen the whole data revolution when people started talking about AI and ML. Everybody said, okay, all right, let's do whatever we can. But then the maturity came to say, all right, we need a data strategy in place. We need to have data governance in place. We need to have some sort of controls in place.
Right.
Cut to 2024, that's what is happening on Gen AI now. So while people realize there has to be a strategy, they're still kind of struggling to find what that strategy could be, because like I said initially, generative AI still means a lot of things to a lot of people. So it is important as an organization to kind of take a stance and say, this is what we are going to use generative AI for. Let's say it is in enhancing patient outcomes. It could be in terms of improving the experience of the customers. It could be about back office optimization. Whatever that 4 or 5 areas that as a business you would want to improve on or leverage this technology for, I think that is the first step, to identify those areas of action. And then, of course, go through the process of the low-hanging fruits in those areas to see what are areas that could give us immediate results. So there are two aspects to this, Sai. One is the technology side of things, and then the business side of things. So implementing GenAI for a business point of view, absolutely, you should have that business case and all of that, but you should also have an equally strong technology strategy underneath. Like, for example, what are the models I'm going to leverage? Am I going to do open source? Am I going to do closed source? Is it better that I, as an organization, go directly into, let's say, a Microsoft Azure kind of an implementation and kind of build my entire generative AI strategy on Azure, or do I do it with AWS, or do I kind of bring the whole thing in-house and do it on my own infrastructure? So these are all questions for organizations to ponder upon, especially based on the criticality of the data and the business problem that they're trying to address. Now, in a healthcare scenario, we are seeing most organizations preferring to do everything in-house, which means they are taking open source models, customizing those models and deploying them within their own infrastructure so that they could leverage it and train those models on their own data, rather than be at the mercy of a provider like a Microsoft or AWS, where you don't know. By all means, the licensing agreements do stand for something, but that said, you would never be reading the whole of the fine print. In that sense, to go back to your question about what are the strategies that companies have to look at, number one, to try and identify what generative AI means for the organization. What are the areas or business functions that they would look at generative AI making a realistic impact on? Number two, identify the low-hanging fruits on these areas. And number three, have a strong technology architecture in place about how you are going to solve these problems, and have some sort of homogenization in terms of how you're addressing those problems. I mean, it's easier to get carried away by a product that comes out in the market claiming to be a generative AI product that solves a particular problem. So you implement it, but then 3 months later, you have a different problem and this solution doesn't work anymore. You're then having to go and shop for a different product or a model. So it's important to address those gaps. So the typical pitfalls will be like that in our experiences. Like, number one, you're solving the wrong problem. That's a typical pitfall that many companies are falling into, just because they get carried away by what generative AI brings to the table. So the generative part of AI becomes more important, whereas the realistic solution probably is just an AI solution that they read. They probably just need an ML solution. So that is the first pitfall that we are seeing, is like more and more companies are gravitating towards solving problems as generative AI problems, even before defining them as being really generative AI problems. So that is one area we are seeing. And the second one is the security not being the biggest pitfall is like, not paying enough attention to security, not paying enough heed to where does the data need to sit, what are we using to train the model, who's training the model, which team, which department has access, etc., etc. So that sort of thought process. So these are some of the pitfalls, and obviously the best way to come around any of these things is build that amount of maturity and practice and good governance into the way you structure your organizational data, the way you structure your organizational models, and so on and so forth.
Got it. Very relevant. Obviously, in the context of many different enterprise companies, business sizes that we deal with, Ajay, traditionally the diagnosis and treatments are one size fits all. But then that's not going to help anyone's cause if you're looking at a demography of various different data sets and patients and whatnot. How can generative AI be used to analyze vast amounts of individual patient data to create a truly hyper-personalized treatment plan? How do you think this technology can disrupt that? Or probably it's already disrupting. Maybe you have some experiences to share here.
Yeah, so you rightly said, now today healthcare is very much like one size fits all. You go to a physician with a condition that is common. The physician would recommend you dosage, drugs or therapies or treatment that he would have recommended to any other patient with similar condition. But that's not how your body deals with situations. Every individual body has a different genetic makeup. The genomics behind is entirely different. Your ancestry is different. My ancestry is different. My lifestyle is different. My activity history is different. You do a certain few things, and you are passionate about doing a certain few things in your life. I am entirely different. So giving the same dosage, a drug or treatment or therapy to every and each individual is not going to solve it. And it doesn't, because even if you look at people suffering from diabetes, every individual body processes blood sugar differently. It's not that somebody has a level of certain blood sugar level of 5 versus somebody has a 7, one is bad versus the other, because it's his or her own individual body. So therefore, I do see generative AI, like I said before, provide data-driven insights.
Right.
Mine through all different EHRs and EMRs and the IoT sensor, actuator, device data, and all the medical research that has been already done and is publicly available, and try to identify what the patterns and symptoms are, and then provide predictive, proactive care, not a reactive. There may have been a lot of different times when you go to the physician, and when the physician recommends you a drug, you say, no, why this drug? I know this drug has so many so and so side effects. Why not the other drug? He would not have an answer. He would give you that drug and monitor you for 3 months and ask you to come back after 3 months. Why should human beings be? We are not guinea pigs here to be experimented. Why not use a technology that can overcome all this human limitation to decipher tons of to understand and interpret from minds and minds of data that is already available, right? So genomics, I do see, not only can overcome the data limitation there is, it can you can use AI to generate synthetic data. So you can use generated synthetic data to train large language models also. And it is believed that if you train large language models with synthetic data that is generated through AI, the accuracy happens to be higher than if you are relying on traditional historical data that is available with the healthcare providers. So there are ways to overcome. Obviously, there are biases and concerns and transparency and privacy and ethics-related issues, but we cannot shy away from the technology, right? We have to think about, we have to genuinely do trade-offs like Ram highlighted earlier, and there are ways, techniques to do trade-off. Well, hallucination is something that is very well known in the generative AI and large language model fields, but there are ways how to overcome hallucinations, right? And there are ways how you can establish guardrails and guidelines and frameworks to eliminate bias by diversifying data, by adversarial training. But there are a lot of different ways how you can overcome the shortfalls. I do see generative AI playing a significant role in shaping healthcare in future. So I am a firm believer. There are a multitude of use cases I can highlight. Today, say for example, you have a unique condition, or you're changing your location and you have to find a provider for your family members. Because you're new to the location, you have to find a provider. You go to the insurance provider's portal and look for the provider, do research on their credentials, and look for providers that are accepting new patients, and then decide on, okay, I want to go for this particular provider because one of my family member has high blood pressure or high cholesterol, and I need unique treatment, a physician who has specialization in that area. Why should you be doing all that? Today, in the world of generative AI, you should be doing natural language search based on what you need. You should be looking up on portals and saying, I have a family of 3, and so family members have these conditions. Please find me a provider in the place that is covered within my insurance and offers these kinds of services and has the best possible ratings and is known in his field. Right? I should be able to do search in natural language. And there is another use case. Today, if you go to a physician or go through a treatment in a hospital, the provider actually sends you the insurance provider actually sends you an explanation of benefits, saying, oh, you have been through this treatment, there was this anesthetist present, there were these specialists there, this was the surgeon who did your procedure, and there were many others who you may not even recognize, and they say, okay, these people have charged you so and so based on your coverage plan. And then later on, you look at those documents, you do not make any sense of all those codes and the services that were offered, and you trash it, and then happen to call the call center and talk to a representative and say, hey, why was I charged with so and so amount for this particular surgery? And why was I not told about this upfront? So those paper documents, why should somebody be going through all those reading through those paper documentation to understand what happened? You ask simple questions. Have a chatbot that is more empathetic, compassionate, more context aware, and you ask the chatbot, okay, so how much am I entitled to based on my insurance plan that I have? And when I went through this procedure, what were the different services that were offered? How much of that was covered within the plan, and how much was out of pocket? What am I entitled to? What am I left off balance for the rest of the year? All that should not be deciphered by a conversation with a call center agent. Rather, it should be more self-service, right? I ask a question. There is a chatbot. I ask question. Okay, tell me what is the procedure? What are the different codes? What is covered? How much do I have to pay? And how much is left out of balance, right? So there are a multitude of such use cases that can be implemented using generative AI. Of course, I understand there are concerns around the transparency, auditability, explainability, security, privacy, and all that. But we cannot shy away from the technology. There are ways to do trade-offs. One versus the other, compare, contrast, open source versus closed source. There are obviously there should be stress on implementing all the guardrails, guidelines, and frameworks to eliminate bias and take this technology forward. This technology is not a technology; it's here to help us. We have to figure out how to best make use of the technology to empower the providers, to empower the patients to take care of their own health.
Brilliant. No, I think I do completely agree, because I have spent considerable time in enterprise AI and conversational AI platforms. I sort of understand what you're talking about, the fact that today a lot of the common stuff that we would otherwise want an agent to be in place, to be DIY, self-service, and multi-model. I think you're truly right, and I love the statement, the fact that you said it is up to us to figure out what is that we could take out from this technology rather than getting paranoid about it. I think that's the way forward. And you also covered a lot of ground, in fact, on the question that I actually was, intending to ask about the impact of explainability, the bias, how do we deal with it, and the responsible AI piece. I think you've covered that at length, which makes me get back to Ram. Ram, so, this probably would be something that we would love to have you speak as one of the final comments from you. With multiple Gen AI models and length and breadth, right? So, I mean, the last count somewhere I read, there are more than 500, 600 language models of various sizes that have been built already, or probably the number is even higher. Uh, the complexity surrounding it for an enterprise to truly integrate with enterprise architecture, right? So how can organizations equip themselves to overcome typical languages and typical challenges? Sorry, right? I heard large language models, small language models, tiny short models, vertical specific models. There's so many other lingua that I've been reading about. But since you spend significant amount of your time architecting complex enterprise solutions and making them simple, where do you see this whole puzzle getting fitted, and how do you go about it from an architecture standpoint?
Right, Sai. And they're only going to grow, right? And the
Hmm.
number of models are only going to grow, and exponentially so. And before I just go into the point that the question you've asked, one quick comment on something that you said earlier about, and what something Ajay said is very, very important is this technology is here to stay. Let's all recognize that. And HTTPS came something like 5 years after the original HTTP came. So things will improve. There will be problems and there will be solutions. There will be new problems. There will be new solutions. And that's how technologies evolve, right? So this is one of the things that we are having a lot of conversations with customers. And when they say, look, I would like to do something on GenAI, but I'm not really sure if I should be doing it now, or if how it'll, how my team would take it, etc. So it's about that education. It's about kind of empowering people to kind of for themselves also, for teams themselves also, to kind of look at generative AI as an option to kind of make their day-to-day work much better than what it would otherwise be. So that out of the way. So coming back to the point you made, so it's very, very important that we have catered for generative AI in our enterprise architecture. And what I mean by that is, if you're typically looking at organizational structures, there are two levels that typically teams work on, people work on. One is at right at the enterprise level, and then at the solutions level. At an enterprise level, it is about the choices you make, which we spoke about previously also briefly. What cloud, in-house, outsourced, commercial product, SaaS, PaaS, etc. And then at a solution level, you need to make accommodations for generative AI in whatever software you're architecting. What I mean by that is, typical, three-tier architecture of a front end talking to a back end via a middleware has already evolved into a microservices architecture. Now these microservices are being evolved into orchestrated microservices architecture. That has also happened. The next step would be, generatively orchestrating microservices is what organizations need to be thinking about in terms of that growth curve. To see where they would be is like, the organization,
Correct.
the application would themselves decide what orchestration patterns to implement. And of course, there are mitigations you'll have to do for the hallucinations that are bound to happen. You have to have domain-specific models. You have to do all of that. So the plethora of models doesn't make any of this decision-making easy. And that's why one of the things we've been doing with our platform called Zastra is where we have created a workbench of a generative AI LLMs that are available, so that people can kind of choose the model that fits the problem.
Got it.
Then solve that problem for that particular, using that particular model. And sometimes it could be a chain of models that you're using. Just to give you an example, one of the things we've done is like we have taken a set of use cases that are written, and using a text converter, text generation model, we have created test cases out of that use cases.
Got it.
And then what we have done is we have taken those test cases and then implemented a code generation model to develop automated test cases for those code, for that test cases, automated code for those tests.
Understood.
Just one such example of how you can cascade multiple models and build out a business solution. And that is definitely the way of the future. And there will be, again, like we were saying, there will be many more such models that will happen.
Correct.
And it's only, the wise approach is, number one, have an enterprise architecture level view of where you want your models to be, how your what decisions, cloud, in-house, etc. Number two, make accommodations at your solution level for incorporating generative AI models. whether that is as a backup to your existing processes to be expanded into your mainstream at a later point in time, or as your primary source of implementation. And then finally, you will need to have that ability to use horses for courses. Choose the model that you want to use for a particular problem and then cascade it to solve the bigger problem.
Fair enough. I think succinctly put and quite relevant to what the maze of enterprise app architectures that we all deal with and the plethora of language models that seem to be already coming inside. I will probably, go back to Ajay once, and then as a final note, Ajay, what I found interesting was a recent McKinsey report, which actually stated GenAI can help unlock a piece of the unrealized $1 trillion of improvement potential that's present in healthcare, right? That's a substantially large number by any means. So, how do you, as both a business leader and a technology leader, interpret this statement? What steps would healthcare executives want to take to integrate GenAI into their existing frameworks? I know we probably covered a lot of this ground, but since this is something that is seriously large business opportunity that we are looking at, bringing in significant improvements in healthcare, some final comments from you would be really helpful.
Mhm. So based on what I understand from the McKinsey report are four things. So one is transforming care delivery using generative AI. Second is accelerating the R&D process, right from the concept all the way to production. And you can use generative AI for that also. Optimize all the administrative burdens there are, note-taking, exchanging documents, eliminate all that. There are possibilities of doing so using generative AI. And then the fourth one is data-driven, value-based care models, because it is humanly impossible to decipher the minds of data that there are both in the public domain and data that is very specific to patients through their healthcare electronic health records and medical records. So why not leverage generative AI to overcome the human limitation? Let the generative AI decipher all that data, identify patterns, summarize, synthesize, and give more predictive, proactive answer rather than human beings being reactive to a situation. So there are a multitude of use cases that I have highlighted to the entire podcast, and there are several things that Ram mentioned. In fact, generative AI is not only going to improve healthcare, it's going to impact everybody's life. Even people who are working in IT, architecting and designing products, their life is going to be impacted by generative AI with all the different workflows there are in doing trade-off analysis, designing evolutionary adaptive architectures for future, or writing code. So everybody's life is going to be impacted. So why not leverage to the fullest and make the healthcare the future that we aspired for so long, right? Make it personalized, make it specific, use generative AI as a technology, and shape the future of healthcare.
Fair enough. No, I think the last 40 minutes, I'm sure, has been enthralling. What we started off was the perspective on what today's world, where hyper-personalized healthcare with data-centric decision, swifting through petabytes of data, analyzing that, and then we sort of delve deep into multiple language models, sweeping through enterprise architectures and the complexity that someone needs to. We also probably touched about various journeys that customers are going through in terms of adoption curves. And then we looked at the disruptions in remote patient assistant care, then conversational AI, virtual assistants, hyper-personalized solutions. And now from a future standpoint, $1 trillion by any means is significantly larger number. And I'm sure the best is yet to come, as they always tell. But if there is one technology that can truly revolutionize the most important aspect for human care, right? It's about having a good life. That's always recommended, and that's where I believe this conversation that we had today threw in a lot of insights. I'm sure our audience would be very happy to hear this podcast, and I'm equally sure they would have follow-up questions, which I will circle back with both of you. But thanks once again for both of you to have spent time, shared it. I could also see pragmatic insights from both of you. Have done, implemented, seen it, and done it all sort of insights. which is what the whole spirit of digital dialogues have always been. We will revert back and towards one last time to my audience. So thank you everyone for tuning in. As always, Cigniti's commitment towards bringing in rich, pragmatic engineering insights and business insights together in the modern day world and enterprise disruptions that are happening will continue. And stay tuned, and hopefully we will go with this edition soon on our social channels. And I thank once again everyone. Thank you, Ram, and thank you, Ajay.